Good morning, colleagues. I am Professor Foday Sahr, the National Coordinator for the National Task Force on Drug and Substance Abuse in Sierra Leone. In Sierra Leone, a significant rise in mental health and substance abuse cases was observed between 2020 and 2023. Advocacy Mental Hospital, a rise of over 1,200% in substance abuse cases was observed between 2020 and 2023. And for Kush in particular, which is a synthetic drug that is currently being identified as being misused in Sierra Leone, over 3,800% surge in Kush admissions were observed during the same period. This trend informed the decision of the government of Sierra Leone to establish the National Task Force on Drug and Substance Abuse. Since my appointment as National Coordinator of the Task Force on April 9th, I would like to provide an update of what we have done and where we want to go. Following guidance from the Presidential Advisory Committee, the National Task Force has established a lean and robust response structure. We have conducted a rapid scoping mission across all 16 districts in the country to engage district leaders and to understand the magnitude of the Kush problem at community level. The goals of the response are 5. The first one is we want to reach 70% of communities nationwide with communications and community engagement interventions within the first 1 year. Number 2, we want to reduce youth drug abuse by 80% within the first 2 years. Number 3, we want to establish at least one facility-based center for severe cases and community-based therapy for mild cases at district level within the first 1 year. And the fourth goal is to support 70% of individuals to return to work or education within a year of treatment. And the last one is to reduce the availability of Kush by 80% within 1 year. What is our response structure? The National Task Force response structure leverages expertise across various government agencies, including the Presidential Advisory Committee, the National Coordination Team with a 24/7 situation room at the National Public Health Agency. We have 5 response pillars led by relevant government ministries, departments, and agencies. And we have district leadership in all 16 districts. What is our strategic approach? The task force aligns with the 5-pronged strategic approach outlined by His Excellency the President. And that is 1, we want it to be cost effective. It has to be data driven. It focuses on capacity building of existing structures and emphasizes community ownership and sustainability. The response of the task force utilizes comprehensive continuum of prevention and care approach, encompassing identification of Kush users, treatment, recovery, and reintegration. As stated earlier, the response has 5 pillars, and these are 1, public information and risk communication. This pillar is led by the Ministry of Information and Civic Education and co-led by the Ministry of Health.